Hello, I'm Josh and today I'm interviewing Paula and Ruth. Do you want to introduce yourselves?
I'm Paula Evans and my job is I'm the sepsis lead nurse at Sherwood Forest Hospitals.
And I'm Ruth Harrison, I'm the lead learning disability nurse for Sherwood Forest Hospital.
What do your jobs include?
I'll let you go first.
Okay, so I am responsible for the whole of the trust for all of the improvements that we make in sepsis care, things that clinically happen to the patients that have got sepsis, and also for the way we look after antibiotics.
So the role of the learning disability nurse came about for acute care as a result of avoidable deaths of people with learning disabilities, and sepsis is the number 3 killer of people with learning disabilities, and sadly it is on the increase, but we also know that it's avoidable. So the role of the learning disability nurse is to proactively reduce avoidable deaths, bring learning disability to the hospital's kind of agenda in policy setting, support people's roles throughout the hospital in terms of consultants, medical staff, nurses, physios, that type of thing, but also to follow a person through the whole hospital so they don't get lost, give them a bit of a voice, and look at kind of the delivery of holistic care.
How have you found it working with our students?
It's been really, really fun. So I nominated myself as the sister of the person with autism and learning disabilities, which was also one of your students. So yeah, it was a laugh. It was a laugh. But I think for me what was really nice is one of the students actually said they knew nothing about sepsis before they started working with us, but now he'd learned a lot that he was then going to go and talk to his family about what sepsis is and the signs of sepsis. So actually it's not just about people with learning disabilities, it's everybody.
How do you find it juggling both your day jobs and working with our students in the industry work placement?
I think we've had many years at doing that though, haven't we? We've had a lot of practice of juggling deadlines, juggling the day job, juggling families, juggling holidays, and it is something that we probably would have found difficult to have done back being a teenager many years ago. But it's life. Yeah. It's life. You have to get on with it, don't you?
And you learn to do it. It's experience that teaches you how to do it. But for us, I have to admit, it has been great fun and hugely rewarding coming out and working with you guys.
I've missed it. I've proper missed it.
I am sitting now wondering, I need to get another film made now just because I want to keep doing it because it's been great. It really has. And it's the fact that you're local to us. And part of what we try to do at the hospital as well is about working with the community, not only clinically for the work we do with our patients, but actually for other organisations so that everybody's involved. So the fact that we can say to NHS England, which is who this video is for, that actually it's been made in collaboration with a local college, with local students, and that the guys here have all sort of contributed to something that's going to be national. It's just brilliant.
In terms of yourself in the NHS, how do you aim to help staff and students that want the industry work placements? Well,
from our hospital's point of view, we're more than happy because the hospital's big enough. There's lots of different departments that do lots of different things. And our hospital is really keen to take students on placements and to get them involved in sort of projects and things like that. So
sepsis is just one part of it. You've got to think about all of the other areas within it: respiratory, cardiology, gastro. There's so many other areas, and like I say, for us, if the students have took a bit of learning away for learning disabilities and sepsis, you imagine the students that are going to go on and do respiratory and all of those areas. They're going to learn quite a lot.
As a student, I believe that work placements help students by giving them the experience they need for their future and a gateway into the industry they have been working to get into. Would you say that this is correct, or do you have a different opinion on this?
No, I think that's spot on actually. The students that work with us, they got a lot of experience in a wide range, not just the filming and the editing, but being in different environments and being restricted because, for example, when they came to film in the hospital, there are restrictions that you have to follow purely because it's a clinical environment. So I think the experience was absolutely invaluable, and they've got something brilliant now for their portfolios. Even if they don't want to go on and pursue a career in media or filming or whatever, it's something that's on their CV to say they've done this, you know, for a big national organisation, something they can be really proud of.
What is the most rewarding part of your job?
For me, I think I've put learning disabilities firmly on the agenda within not just our trust, but also within the community. So some of the work that certainly myself and Paula have been doing has been shortlisted for quite a prestigious award, a Patient Safety Award. But not only that, we've been asked to talk at national conferences, and some of the work that we've done is actually not only reached this country but has reached other parts of the world as well, which I just think is epic, to be fair.
I don't know that I can say there's one thing that's the most rewarding thing for my job, to be fair. I am still quite hands-on and clinical, so I have a lot to do with patients still. So I do still get a buzz when I can make a difference to a patient's care, but I'm also in a good position because actually the role that I do now, as Ruth says, the work that I've done and for other places to adopt it, I know can make a difference nationally and potentially internationally. So it's just nice knowing that I can go home at night and go, yeah, I did a good job today.
In terms of work placements, it's not just our film and TV students that can come in, do their job and get something out of it. There's students in other courses that can go into these industry work placements. Where do you think a student can start looking for an industry work placement?
I think they need to search within themselves around what they actually really want to do, and then take that leap of faith and just pick up the phone. If they've got a passion in terms of learning about health, pick up the phone and talk to somebody obviously within either our trust or with any of the local health areas. It depends what it is, what they want to do.
And don't be afraid to think outside the box, because actually sometimes it's really refreshing to have somebody come and say, actually, I've had this idea, what do you think? Because for us to have sort of a fresh pair of eyes, look at something and think about something slightly differently, particularly because there often is a generation gap, because you guys think very differently to the way we do, and actually sometimes that's a really good thing, because the students that we were working with, they came up with all sorts of really good ideas and we thought, oh, I hadn't thought of that. So don't be afraid to tell people what your ideas are, think outside the box. And actually, just because you're so for us in healthcare, just because you're not necessarily in a healthcare linked course, doesn't mean to say you can't work with us. So for example, the guys that are doing the beauty courses that do the makeup, we need people to do makeup in the hospital because we run trauma moulages and trauma courses. So we want people to be made up as though they're injured and covered in blood and gore. And they might not think about that, but actually it's good skills. So
I think that's quite important as well, because we do have patients who are going through like chemotherapy, other therapies in terms of cancer, and they do beauty sessions to actually just make somebody feel okay. But likewise, we've got a health event coming up, and one of the things we wanted to be able to offer for people with learning disabilities is therapy sessions, because they might not know that they exist. So yeah, it's putting yourselves forward, reaching out and not being afraid to reach out, because nobody else will do it for you.
So let's say we had students who want to come in and work for the NHS. How would you recommend they contact the NHS for their work placement?
Well, there's internet sites, there's Twitter sites, there's obviously the telephone, they're also on Facebook, so private messaging through any of those, whichever way really.
And there is a work placement officer, certainly at our hospital, so I would imagine there are other organisations as well. But yeah, just pick up the phone and ask. You can always find somebody.
Unfortunately, that's all I have for you. Thank you for letting us interview you.